Welcome to the first fill on Happy American Pharmacist Month. My name is Katie Meyer and I serve as the Senior Director of Content Creation here at APHA, and I'll be the host for this episode. With American Pharmacist Month this month, we thought it was really important to focus on the critical role that pharmacists play in improving outcomes in public health. From serving as a vital community resource, helping patients navigate their insurance for access to medications, to ensuring patients are on the correct medications upon discharge to the hospital. You, as pharmacists, play such an essential role for your patients, so thank you for all that you do. And from a guest perspective today, boy, do I have a treat for you. In part one, we discussed recent guidelines published for community pharmacists about MOUD, and today I'm joined by Jake Nichols, a pharmacist and friend of mine who's dedicated his career to serving patients and educating pharmacists about how to care for patients with substance use disorder. Welcome, Jake. Why don't you introduce yourself and tell listeners a little bit about yourself and your story?
Hey, Katie, great to be here as always. So, my journey has been interesting, I guess, to say the least, but ended up working in a field, specifically substance use disorders, that I had never planned on working in. I found myself in treatment after a 15-year history of substance use back in 2010. I fell in love with this field and have been working in it for the past 15 years for the time that I've been in recovery. I've done many things from academia to managed care to working with pharmaceutical industry, and recently started my own company called Ignite Biomedical, where we develop blood-based biomarker tests that will determine whether or not somebody will respond to certain drug therapies.
Thanks, Jake, for that introduction. I'm really happy to have you here today with us. As I was reflecting on the discussion that I had with guests from last week, one of the recommendations in the Pharm OUD guidelines that we spoke about was related to stigma, which is really so important to consider when we're speaking to a person with OUD. Jake, I've listened to your talk on shame, which is related to stigma at the APHA Institute on Substance Use Disorders, and it's just so very impactful. So, why don't you tell listeners a little bit about how shame has impacted your journey with SUD?
Yeah, sure. Shame has been a massive part of my journey in both a positive and a negative fashion. And as many individuals that struggle with substance use disorder beyond our own profession experience early on, shame is extremely debilitating. You find yourself in a situation that you had never possibly imagined yourself to be in, where you start to feel inferior, you feel worthless, you feel small, you feel helpless, especially as it relates to your own peers and other pharmacists. We'll talk about stigma later, but they do go hand in hand, and both of those together can have really one of two. It can have two distinct effects, and unfortunately, many folks, their reaction to shame, or what we refer to as toxic shame, tends to be more of the retreat aspect. And again, this isn't just pharmacists, this is anybody that's found to have this disease, whereby the shame causes you to retreat from, your social circle, your family, your own profession. A lot of pharmacists that end up struggling with SUD never go back to work within the pharmacy profession. They seek other career opportunities, and that's primarily because of shame. And the second effect that it can have, and the effect that it had on me, is more of a motivating factor in terms of wanting to address this shame, understanding where it comes from, and utilizing it to a degree to motivate yourself to want to do better, to want to break out of this. And for me, it was really just a reflection on the quote unquote damage I had done, and my ability to be able to repair that and move forward and share my experience with others with the hope that I could help some folks in the process.
Thanks so much for sharing that, Jake. You mentioned stigma. Let's focus on that a little bit more. So, how does shame differ from stigma, and what are the potential results of both shame
Yeah.
and stigma?
Yeah. So shame is, again, can be a positive or a negative factor to some degree. There's healthy shame and there's unhealthy shame. And I talked about how those can motivate you either way. But shame is also an individualized internal factor. And in many cases, it's a reaction to what I call the perceived audience. You perceive that people are judging you or they're making assumptions about you that may or may not be true. And nobody likes being judged. Stigma is a mark of infamy. It's a little bit more permanent. It's a little more universal. It's something that is usually carried over from generations, from decades. And it's really a judgment that people make almost instantaneously. In many cases, they're not afraid to display their stigma. There is still a tremendous amount of stigma for individuals that are found to have substance use issues. It has certainly gotten better in the 15 years that I have been working in this field, but it's still, in my opinion, the primary factor as to why we're facing the scope of this epidemic that we have been for decades now.
Our audience is a bunch of pharmacists that really want to help and support these patients. Thinking along those lines, what can pharmacists do as that community resource to recognize that shame and then support people in a way that's free of stigma that kind of are experiencing it?
Yeah, this is a relatively common question I get, Katie, and the answer is actually pretty simple. It's being more self-aware, meaning how you carry yourself, your expressions, the language that you use when you're interacting with somebody who's in recovery or still struggling with substance use disorder really goes a long way. Because if you take into account the stigma and the shame that these individuals have experienced and are experiencing, when they come up to our counters or we encounter them in the clinic or whatever setting we work in, they are in most cases expecting that degree of judgment that in many cases other healthcare providers have, you know, put upon them. And when you are able to break down that barrier instantly with these individuals, you have a much more optimal therapeutic interaction, as I like to say. So, again, the language that we use, staying away from terms like addict or drug abuse, talking about, your role as a pharmacist and really just emphasizing to folks that you are here to help them in any way possible as they take their journey through recovery. Don't assume that people know how to take buprenorphine the right way. That's always a tough topic for pharmacists or any medications for any SUD for that matter. Don't be afraid to offer counseling as it relates to that. But it's really just comes down to showing interest, trying to reserve our judgment and how we again display ourselves and carry ourselves and be very conscious of their body language as well. In many cases you can see almost instantly how somebody is feeling about this interaction in terms of how they carry themselves. They may be coming up to the counter or again to your desk or your office with their head down. They may be avoiding looking at you. They may be scratching their face or other areas of their body. That's signs of nervousness. That's signs of concern. And with any patient, the sooner we can allay those concerns, the better off we'll be in interacting.
Thanks, Jake, for really driving home the importance of the pharmacist and also just what they can do and how they can interact with patients with OUD to support them through their journey and really promote trust. All right, y'all. Let's summarize major takeaways from our time here today. Shame is a primary factor that influences the ability of a person with substance use disorder to achieve and maintain recovery. As pharmacists, it's important that we communicate in a manner that avoids stigma, ensuring that we're self aware during our encounters with people who suffer from SUD. Remember, your patients are expecting judgment, and by breaking down barriers and walls, your interactions will be all the more impactful and effective. If you haven't listened to part one of this month's First Fill podcast yet, it was released 1 week ago. In that episode, I hosted APHA's Executive Education Fellows and we reviewed the recent Pharm OUD guidelines released by NABP and NACP. Definitely check those out. For any listeners who practice in states that have authority to prescribe MOUD, APHA has an 8-hour training program on initiating buprenorphine that meets MATE Act training requirements. Definitely check it out if you're looking to renew your license or become a provider to support persons with OUD. And last but not least, don't forget to head over to the Learning Library at learn.pharmacist.com to earn your CE for this month's podcast. We'd love to hear your feedback on how you like the new setup. Take care.